Aloha, I'm Dr. Lisa Kim, and this is Everyday Wellness. Today we have Dr. Kristen Coles, a naturopathic physician, as a guest, and I would like to welcome you to our show.
Thank you.
Thank you for coming on our show, and could you tell us a little bit about yourself for the viewers who are watching for the first time?
Sure. Well, I am a naturopathic physician. I'm also a licensed acupuncturist. I currently work in private practice. I'm in a group practice at Steelsmith Natural Health Center, and I work as a primary care specialist. Also, as a naturopath, I do a lot of prevention and a lot of natural therapy and natural health for anyone from kids all the way to adults and elderly.
Right, and I know that you're really good with female hormones, so today I'd like to talk about balancing the female hormones naturally. And in order for us to understand about the female hormones, we need to know about the normal cycles and normal hormones. So could you maybe explain and elaborate a little bit more on those, please?
Absolutely. I think it's very key to give our viewers an idea of what normal is, because there are many, many women out there, and many women who walk in my office who really don't know what a normal cycle should look like. It's not something that we really have extensive conversations about, even with our, our friends or our mothers. It can come up here and there, but it's not something that gets, freely shared. So a lot of us just kind of have our periods and our cycles and don't really know if it's how it should be or how it isn't until we maybe see a doctor or, investigate further.
Right, or, when something is really wrong, like severe cramps or different types of bleeding, that's when we start to ask the doctors, but sometimes we don't always get those answers that we needed to. And there are also a lot of misconception about hormones and what should be the normal levels.
Absolutely, and I really enjoy being able to share about how we can balance our hormones naturally, because I think what you'll find is that my approach as a naturopath is very different than walking into maybe your conventional gynecologist's office with a certain complaint and leaving with a prescription for birth control pills. Right. So there's a lot that we do and a lot that we can learn about our hormones in that regard. So let's start with the main players in a woman.
Okay.
All right, we have a few very important hormones, and again, a hormone is a chemical messenger. They are steroid-based hormones, and they are made in our body. And we talked in previous shows about some other hormones, like our thyroid hormones and our adrenal hormones. Right. Our ovaries are kind of that third little piece to our kind of hormonal trifecta as women. And the hormones that we are going to be talking here are estrogens and progesterones as the main female hormones. Right. We also have some testosterone, which would be termed an androgen. Testosterone, most people think of it as a male hormone, but we actually, as women, we do have some and we do need some, so we'll touch on that briefly. Now, when we talk about estrogen, most women have probably heard of estrogen as a term, and the estrogen hormone is actually a combination of several different hormones. So we have three key estrogens. We have estrone, estradiol, and estriol. Okay. These three are termed the estrogens. When we measure hormones levels, the distinction comes in then on what we're measuring. The distinction is also important when we have discussions about things like hormone replacement therapy, because the different types of estrogen actually have different roles and different strengths in our body. So estrone would be considered one of our very strongest estrogens, followed by estradiol, which is about 80% strength, and then estriol is our weakest estrogen. It's also our safest type of estrogen, and one that we want in higher concentrations if we were to do hormone replacement, which we may be talking about when we discuss something like menopause. Right. So those together I will just be terming as our estrogens, and that's the combination of all of those in our system. Okay. Those estrogens actually break down into many different types of estrogen. When we talk about abnormal issues with hormone metabolism, I will discuss more in detail some of the key breakdown estrogens. There are certain ones that we've found and we know actually are conducive to breast cancer development. And there are others that are protective.
Right.
So knowing our concentration of those
Right.
does play a role when we talk about abnormal estrogen development.
So when you talk about the strength of it, you're talking about the concentration?
Concentration and how effectively that estrogen binds onto an estrogen receptor and stimulates the tissue.
Right.
So we have hormones and then we have receptors for the hormones. And we have to have both of them together in order to have a hormonal effect. And in talking about estrogen, it becomes important to discuss these receptors. We have receptors for the estrogen hormone in a lot of key places. Breast tissue,
Okay.
uterine tissue, ovarian tissue, even adipose tissue or our fat cells, our brain, okay, our blood vessels. Many, many different systems have receptors for estrogen, even though we term it sort of a female like ovarian type hormone. It actually works in the entire system.
Right.
And certain hormones and estrogens will bind stronger to these receptors than others. So it's a concentration, but also the ability of the binding to the receptor to create a response in the tissue.
So the common misconception is that hormones are only in our female organs, right? Instead of thinking about this receptors that are pretty much in entire body.
Exactly, and that's why when we discuss things like women's health or female hormones, we will actually be discussing so much more than just cramps.
Right.
We'll be talking about things like hot flashes. We'll be talking about things like how the brain is functioning, mood, irritability, breast tissue symptoms, the skin. All of these places will be affected, especially with estrogen, which we will get into more depth on. So that's sort of estrogen and a little bit about estrogen. Then we have progesterone.
Right.
And progesterone is sort of the yin to the yang of estrogen. If anybody knows about sort of yin and yang, as a Chinese medicine acupuncturist provider, I do a lot of looking at the balance between things. And progesterone is more of a calming type of hormone. It's very, very useful for many different things, which we'll be talking about in the system. And it pairs with estrogen.
Right.
These two hormones make up the bulk of hormones that create our monthly cycles.
Okay.
What I'd like to talk about next is the cycle itself
Right.
and how estrogen and progesterone and something called our HPO axis work. So our HPO axis is our hypothalamus, pituitary, ovarian axis, and that's basically a fancy way of saying how the brain helps control our ovaries and when we do things like ovulate and have a menstrual cycle. So estrogen is the first hormone that is secreted in the very beginning of our sort of cycle.
Right.
Now, what does a normal cycle entail? Day 1 to day 28 is generally termed an average number of days in a cycle.
Right.
Day 1 I'm going to term as the first day that we have bleeding. So the day the period starts is day 1. That is a new menses cycle.
Right.
And normal is anywhere from 26 to 32 days. 28 is right in the middle, so we pick 28 as that average.
Right.
Ideally, we have day 1, period begins. That is, the period is the shedding of the lining of the uterus. The uterus will be the area where a fetus grows and attaches, and when we are basically trying, that's what our bodies are trying to do every month is, prepare for possible fertilization and implantation, and every month we have to build up a lining in the uterus to prepare for that. When our period starts, that bleeding and that tissue is the shedding of the uterine lining when we are not undergoing pregnancy. Okay. Now, that will generally last for 3 to 5 days, depending on the individual. The amount of bleeding should be moderate. That's another key place where a lot of women have no idea what a normal amount of bleeding is. I have a lot of women who come in and I'll ask them, you know, do you have heavy bleeding? And they say, oh, I think it's normal. Well, normal to them because they've probably never experienced anybody else's bleeding. So you have to get a little more technical. But one thing we do want to watch for is things like anemia. The most common cause of anemia in a woman who is of reproductive age is because of heavy periods and too much bleeding. So that's something that I will get into more detail with my patients, actually, you know.
So what would you consider like heavy bleeding? So for example, and how many times you may have to change your pad, you know, might be a really good indication.
Correct. So questions I'm asking are they having to use a super tampon, a super pad, or do they have to use both? How often do they have to change it? If you're changing it every hour for more than 24 hours, that is significantly heavy bleeding. There's a bit of a concern there. I would absolutely be screening for anemia and discussing ways that we could possibly reduce that bleeding. Generally, I'd say average amount is using a regular tampon and having to change it maybe every 4 hours in the first 24 hours. That's on average. Anything more than that, we start to wonder if it's heavier. Now, the interesting thing is that as women, we start menarche somewhere around, you know, age 10 to 15. It's actually gotten a lot younger. You know, 10 years ago it was more like age 12 to 15. We're now saying it's more like age 10. We've even seen it in girls as young as age 8. Exactly. So we know that we are spending a significant number of years under the influence of our hormones, having monthly cycles. One statistic is that we actually spend 3 full years bleeding as women.
Wow.
Right? So 365 days times 3. That's the number of days in a whole lifetime we'll be actually bleeding for. So, you know, having that understanding that the way we bleed can change significantly over our years through our life. Things can be very erratic in the first 5 years. After women start their first menarche, we can have very erratic types of bleeding and very erratic cycles until things normalize and ovulation happens more regularly. And then at the end of our cycles, when we are in the perimenopause and menopause periods, things again become very erratic. Those erratic time periods are simply due to what's happening with hormonal balance. And we'll get into more detail on those, but generally erratic types of periods are due to the fact that we aren't ovulating. And when we first start having our periods at age 12 or whatever age it is, we often aren't ovulating. We are having a period because the body is secreting enough hormone to try to build a lining, but it doesn't necessarily mean we're actually having ovulation, although it can. So again, we do have to, you know, be aware that we want to make sure that there's no early unplanned pregnancies because we think we're not ovulating. You actually can, but that erratic nature is generally due to the fact that ovulation may occur some months and not others, and hormonal balance is still trying to get situated in the system. So we have about 5 days at the beginning of our period where we're actually bleeding. And that would be termed the period or the menses. Then we enter into what is termed the follicular stage. The follicular stage is when estrogen levels are rising. Okay? And estrogen has the effect of stimulating follicles. What is a follicle? A follicle is in the ovary, and it has all our eggs. Each egg is not developed, it's in a follicle, and based on our hormones, it will develop into an egg that could be fertilized through the length of the cycle. So estrogen levels rise, it's our follicular phase, and around day 14 is the average day they term. That is the day that we have something called an LH surge. An LH surge is the message from the brain that goes to the ovaries that tells the ovary to release a follicle. That's ovulation. Okay, and so for women who are really needing to focus on fertility, ovulation is kind of like the time of the month where everybody's paying attention.
Right.
Because what we want is we want an egg to pop out and then be there in order to, you know, achieve fertilization, then implantation.
Well, not only for the fertility part of it, but obviously there's a lot of brain connection with this, how the hormones are released and how much we produce. So what are some of the things you may do in order to get the brain to start working better so the hormones can release properly?
So many things. You know, one of the very first things I look into, is, which is a combination, is sort of the diet, the lifestyle, the sleep, the stress. How does our brain work? Our brain works on rhythms and cycles, just like all our hormonal systems do. And we know that stress very much impacts the HPO axis, and we know that not enough sleep and a poor diet are big key issues. So before I give anything, I'm going to look into all of those. But there are certainly a number of herbs that we can talk about that have an effect on that brain connection, and we can definitely get into those. But I think, you know, stress is a really big one.
Right.
And we see that all the time. Sometimes all we have to do is balance a little bit on the diet, balance a little bit in the sleep and the stress, and all of a sudden ovulation picks up and things are back into the flow.
Well, the stress on top of it's almost like that urgency to get pregnant.
Yes.
That combined together really, really affects a lot of women and their fertility issues.
It does. It's a big stress on a woman who's feeling that her body already isn't working, and every single month she's counting down the days to that day of ovulation, and, you know, scrambling to get all the pieces into place and you know, get the ball rolling, and you know that we're putting all our eggs in one basket, so to speak, every single month, and it's a lot of stress. But definitely, you know, I think we'll talk about in the future a lot of things that we can do to really help with that. After ovulation occurs, the real key then is that we enter the luteal stage of the cycle. The luteal stage of the cycle is generally the last 14 days of the cycle. And I really put a lot of emphasis and focus on the luteal phase, actually, because this is the place where most dysfunction occurs in many women. And the luteal phase is brought upon by something called the corpus luteum, hence the term. That is the substance that's left behind in the ovary. That is the substance that's helped grow the egg, and it is very, very rich in progesterone. So progesterone is secreted throughout the entire second half of the cycle. And in fact, those levels should rise steadily as the second half of the cycle progresses. It is with a failure to have fertilization and implantation that causes a period to begin again at the day 28